And now we're going to hear from Matthew MacGregor, and Matthew is part of the health financing team at the Global Fund based in Geneva. Matthew.
Okay, thanks, Tim. So one of the challenges of speaking last on a panel like this is that many of the themes that I'm likely to touch upon have been mentioned by previous speakers, which I sometimes wonder if perhaps a good thing, because there's a lot of solidification and consensus on some of the themes around early planning and the need for financing up until the end and the tensions between eradication and transition that the other panelists have spoken about. Thank you very much to the organizers as well. I'm very happy to be here. This is an incredibly important topic for all of those who care about health systems and for the Global Fund, for those of us who care about ending HIV, TB, and malaria as epidemics. So the Global Fund's work on transition falls under the larger umbrella of the Sustainability Transition and Co-Financing Policy. And that policy, which was passed in 2016, really brings together three interrelated themes. Transition, which in many ways is just a process whereby the Global Fund will work with countries to gradually move away from external financing. Sustainability, which is really the desired outcome of all of our investments. How are we increasingly investing our funds in a manner that not only create impact in the short term, but create lasting impact even beyond Global Fund financing? And co-financing, one of the tools, although just one of them, that will help us get there. And when you put those all together, the STC policy is really designed to try to make us invest our money more strategically in a manner that will help us end the epidemics. The policy is a reflection of a number of things, many of which have already been touched upon by other panelists. The changing nature of global health financing, the fact that the Global Fund, like other organizations, increasingly is looking at opportunities and must target our resources to places where there's the highest disease burden and least ability to pay. But it's also based on some real lessons learned about early transitions, particularly of the Global Fund, particularly in places like Eastern Europe, where we did see service disruption, reliance on the fund for key interventions at the time of transition. And it's a reflection on the fact that transitions are hard. They don't necessarily happen naturally. They require investments. They require time. And it's really a codification of the Global Fund's commitment to be a better partner to work with countries to prepare for transition so that they can sustain the gains and scale post-transition. It's based on a number of core pillars. The first is that we need to be working to strengthen sustainability across the Global Fund portfolio. While transition often comes up a lot in these discussions, the more we can make sure that our investments are sustainable, aligned with country systems in the early stages, the more we can avoid the transition challenges we get when countries become ineligible. It's also based on an enhanced focus on domestic financing and co-financing, both an overall increase in the amount of financing that countries are spending on health in the three diseases, but also the specific co-financing of interventions that are predominantly supported by the Global Fund. So in some cases, the situation is where we need to spend, in general, more money on health. But that's not always the case. In many cases, the countries are spending significant amounts of money on health. So but they are not co-financing some of the interventions that we know are the most important to ending the HIV, TB, and malaria epidemics. Third, the need to really accelerate our planning, particularly for all upper middle income countries and lower middle income countries with lower burdens. So this is based on the kind of fundamental lesson learned that other panelists have already touched upon, that transitions take time and early planning is essential. And so while not all UMI countries and LMI countries are transitioning at the Global Fund, we are very proactively discussing with countries the need to plan in that cohort right now. Fourth, the fact that we need to be flexible. There is no silver bullet or one-size-fits-all solution for transitions. The challenges that countries will face and the way that we can support them is going to be based on epidemiological and financial context. In some places, that might be integration of services or efficiency. In other places, that'll be key and vulnerable populations. So we need to be thinking about as flexible as possible mechanisms as we have. And then the fifth is that this is not something we can do on our own. There's a fundamental principle at the fund that we have to be working increasingly with partners, which is very relevant to this conversation, in order to be able to make sure that these transitions are successful. There's a lot in the STC policy. And so I think it's often helpful to think about it by looking across the Global Fund portfolio, or what people often refer to as the development continuum. Because essentially what the policy does is it asks different parts of the Global Fund portfolio to do different things. On the left side, lower income countries and lower middle income countries with higher disease burden. This is where the Global Fund has the vast majority of its allocation and the vast majority of its financing, and this is where we're really pushing increasingly the need for long-term sustainability, strengthened efficiency of investments, gradual absorption of some of the program costs that are dependent upon the fund, enhanced alignment with country systems. And then as countries move to the right, and they specifically get to either upper middle income or lower middle income countries, this is where we're proactively saying to countries, you have to prepare, and you have to prepare now. Again, not because they're all transitioning, but because we know that it's going to take some time. And then finally, one of the fundamental things that the policy did was it instituted the idea of transition funding. Based on this idea that transitions need to be gradual, countries that now become ineligible for Global Fund financing can receive up to one allocation of transition funding that is designed to help them address those bottlenecks that often get in the way of successful transitions. And then the one thing across the bottom of this slide is the policy changed our co-financing requirements. And what it did was essentially increasingly targeted those and made them more progressive as countries move from left to right. So for low-income countries, those co-financing commitments can be general to health. But as you get to upper middle income countries, they need to be on specific disease programs, and half of them, the additional commitments that countries make, need to be focused on key and vulnerable populations, which is really a recognition of the fact that those are often the things that tend to fall apart at the time of transition from financing. So if you step back a second, we should recognize that there's been significant progress. If you look back at the early years of the fund, in many of the countries that are now approaching transition, we used to be funding some of the basic elements of national disease responses. First-line drugs, service provision, and to a vast extent, upper middle-income countries and even some lower middle-income countries have started to take those over. And they now finance and manage the vast majority of the disease response. So there's been significant progress. There's also been significant progress since we've passed the STC policy to embed the thinking about transition in what I call the machine or the business of the fund. The technical review panel that looks at our proposals has had its capacity strengthened. CCMs, our country coordinating mechanisms, are now discussing these themes. And so there's been an embedding of the policy. That said, we should recognize that there are significant challenges. And there are existing challenges, and we should expect to see more. I can't go through all of them, but I'll highlight a few. One of the first ones is around the idea of insufficient co-financing of services for key and vulnerable populations, particularly in the HIV space. Recognizing that some of our early transitions, countries transitioned at a time where they were almost completely dependent on services for men who have sex with men, drug users, for female sex workers, these populations that we know are essential to the epidemics, but often are some of the most difficult politically to finance at the country level. So this is a challenging area, and it's going to continue to be a challenging area, because essentially what we're trying to do is foster country ownership of something that we were financing in the first place because there wasn't country ownership. And so we've changed our policies to try to incentivize this. Our co-financing policy, as I mentioned, specifically requires additional commitments from countries to access our funding to be focused on key and vulnerable populations. Our grants at the upper middle income level have to be the money that we're spending has to be focused either on sustainability and transition bottlenecks and or key and vulnerable populations. So we're working on this, but it's something that is going to be challenging. Another one that I'll mention is early on transition planning. One of the things that the policy said, as others have talked about, is the need to plan early. And we've been trying to build this into our work by increasingly supporting countries with analyzing the bottlenecks or the principal challenges they'll have to transition successfully, and then plan with them to overcome those bottlenecks. And again, this is not always easy, because while we know that countries aspire to manage all of their national disease programs, many of the things we finance are challenging for them to do so. And so it's not a simple thing to start working with them and encourage this country-owned planning. And I'll touch upon two more, and then I'll finish up. But one thing that hasn't been touched upon that much, which is increasingly important to us, is the idea of supporting civil society during transitions. For the Global Fund, particularly for HIV, but also for TB and to some extent malaria, civil society organizations have been at the front line of reaching the most vulnerable populations. But we know that many civil society organizations are dependent on external financing for delivering these services. And so the Global Fund, under its transition policy, has been increasingly working on strategies for encouraging public financing of these CSOs. But we also need to think about more ideas for ensuring that they can continue their advocacy role, ensuring that they have the capacity, and that there's still space for them to both deliver these services and advocate for the rights of populations affected by the diseases. And then finally, things around health systems. There's a number of challenges and bottlenecks related to health systems. Alignment of data systems. Procurement, as countries move away from the Global Fund procuring health products and toward national and domestic procurement. And these are things that we're going to have to address as we move forward. Just really quickly, I mentioned that partnerships will be essential. The Global Fund at its core is a partnership organization, and partners are and will play a really important role in us being able to support countries to successfully transition. And they'll play this important role because many of the actors that we need to engage to push these successful transitions are slightly different than the actors that we engage on a day-to-day basis. So it's increasingly ministries of finance, it's increasingly the private sector, it's increasingly ministries of planning. And the fund needs partners in this space in order to be able to reach these. We're working with partners to coordinate technical assistance, to look at opportunities for increasing domestic financing, to addressing specific bottlenecks, to improving efficiency of investments, but we're going to have to continue to do it. And one note that I'd like to make here is that one challenge the Global Fund will have is that we transition out of countries later than most other organizations, particularly bilateral partners. And therefore, there are very few partners there when we're actually exiting or finishing the transition process. And I actually think that's a call for a very productive discussion here, because we need to be engaging new actors to support this, particularly because many of the other traditional financiers and partners are not there in that space. Finally, I'll just end by saying that successful transitions are going to be essential for ending the epidemics. They embody what we want and what we aspire to in country ownership. And so while they're not going to be easy, governments that can fund health responses in line with their strategic goals should. And the Global Fund, under the STC policy, should increasingly become a better partner to help countries prepare, address those challenges that we know exist to successful transitions, ultimately with the goal of supporting countries and communities to sustain the gains and continue to scale even after Global Fund transition. Thank you very much. I look forward to the discussion.